Sort of. And the honest answer is more interesting than a simple yes. Of all the foods people tie to a lower cancer risk, tomatoes are the one that comes up most often, and the research behind that is real. It is also modest, it points mostly at one cancer, and it comes with 2 twists that change how you should actually eat them. So let me walk you through what we know, and then give you something practical to do with it. The story starts with a compound called lycopene. Lycopene is a carotenoid, and it is the pigment that makes tomatoes red. You will also find it in watermelon and in pink grapefruit. When researchers have followed large groups of people over time, they have noticed a pattern. In big observational studies, including one called the Health Professionals Follow-up Study, people who ate more tomato products tended to have a modestly lower risk of prostate cancer. That is the cancer where the signal is clearest. So when you hear that tomatoes prevent cancer, what the evidence really supports is something narrower and more specific. It is mostly about prostate cancer, and the connection is real but not dramatic. I want to be straight with you about the size of this. The effects are small. Not every study agrees. This is not a food that erases risk or replaces anything your medical team recommends. But a modest, repeated signal across large studies is still worth paying attention to, especially when the food is inexpensive, easy to find, and good for you in a dozen other ways. Now here is the first twist, and it surprises almost everyone. With most vegetables, we tell you that raw is best because heat can break down delicate nutrients. Tomatoes flip that advice on its head. Cooked tomatoes beat raw ones for lycopene. The reason is that lycopene is locked up inside the cell walls of the tomato, and your body has a hard time getting to it when the tomato is raw. Heat breaks those cell walls down. Heat also converts the lycopene into a form your body can absorb more easily. So a simmered sauce, a spoon of tomato paste, or canned tomatoes actually deliver far more usable lycopene than a few slices of fresh tomato on your plate. That is genuinely counterintuitive, and it is one of the few times I will steer you toward the cooked version of a vegetable. The second twist is about fat. Lycopene is fat soluble, which is a simple way of saying it needs a little fat present to be absorbed well. So when you cook your tomatoes with olive oil, or add a bit of cheese, or eat them as part of a meal that already has some fat in it, you meaningfully increase how much lycopene actually makes it into your body. This is part of why Mediterranean cooking delivers lycopene so effectively. The tomato and the olive oil are not just a nice flavor pairing, they are working together to get more of the good stuff across. Which brings me to a question I get a lot. If lycopene is the active ingredient, why not just take a lycopene pill and skip the cooking? It sounds efficient. Unfortunately, the trials have been largely disappointing. When researchers test isolated lycopene supplements in randomized studies, the benefit that we see in whole tomatoes mostly fails to show up. This is a pattern we see again and again in nutrition. A single extracted compound rarely reproduces what the whole food does. The tomato is more than lycopene alone, and pulling one piece out into a capsule tends to lose the effect. So the whole food beats the extracted compound here clearly. So what should you actually do with all of this? Keep it simple. Cook your tomatoes when you can, and lean on the concentrated forms, which means sauce, canned tomatoes, and tomato paste. Add a little olive oil, both because it helps you absorb the lycopene and because it makes the food taste better, which means you will eat it more often. And, if you like variety, watermelon and pink grapefruit bring some lycopene to the table too. Here is where I want to leave you. Tomatoes are not magic, and no single food is going to prevent cancer on its own. But a pot of tomato sauce with a little olive oil is a genuinely good, evidence-informed choice, especially for prostate health, and it fits easily into the way most of us already like to eat. That is a rare and lovely thing in nutrition, so enjoy it.